Afternoon, everyone. It's so good to see you. My name is Megan Lucas, and I'm the CEO of the Lynchburg Regional Business Alliance. I appreciate you taking time out of your day to join us for our weekly Wednesday at 1 webinar. Please remember phone etiquette and use your mute button as we move forward throughout this webinar. As we have shared on social media, and in all of our communications, the Lynchburg Regional Business Alliance has created a coronavirus hub page on our website, lynchburgregion.org. That page is a comprehensive listing of everything that's critical and important to all the business community moving forward. And it has the local resources, state resources, as well as federal resources, all in one location. Please use that website at any time as needed. And if you can't find what you need, don't hesitate to give us a call at the Lynchburg Regional Business Alliance. We're really excited to have with us today some phenomenal guests. We have joining us U.S. Senator Tim Kaine, Barry DuVal, the President and CEO of the Virginia State Chamber of Commerce, and Dr. Kerry Gateley, the Health Director for Virginia Department of Health. Each of our special guests will take about 10 minutes to update you, the business community, regarding the critical work they've been doing in regards to the COVID-19 pandemic. After each of our speakers has had an opportunity to speak, we will open it up to Q&A. I ask that you use the Q&A button at the bottom of your screen to send me all of your questions. And then I'll review those questions and ask them as time allows us. We are recording this webinar, and we are currently doing live on Facebook as well. It is great to see you, and wouldn't you know, as soon as we went live, the sun popped out. So I think that's a wonderful indicator that Wednesdays at 1 webinar is important to everyone. With that, it's my pleasure to introduce everyone and welcome our Senator, Senator Tim Kaine. The floor is yours.
Megan, thank you. And thanks to everybody for being on this call today. I'm really happy to participate with the Lynchburg Regional Business Alliance. I have some staffers on the call that are important to mention. Paul LaPointe is my staffer in Washington who is in charge of all of our policy dealing with economics, business, the economics and business portions of our coronavirus response. And then Gwen Mason, who many of you know. Gwen is the person who's my regional director over the office that includes Lynchburg. So follow-up questions that you can't do today, you could direct to Gwen or to Paul, and we're glad to help you out. Look, here's what I want to do. I'll be very, very quick. We have passed 3 very significant pieces of legislation essentially in 3 weeks to deal with coronavirus. And I want to explain the biggest piece of legislation, which was the economic backstop package that was passed called the CARES Act that the president signed last weekend, because it's very relevant to the business community. And then I'm going to ask you 2 things when I finish. So the package that we passed was more than twice the size of the economic stimulus that was passed in the aftermath of the fiscal collapse in 2008, 2009. And we had to work on it under time urgency, recognizing that the stakes were high, but also unlike any other bill, there were senators and House members being diagnosed and staff members and spouses. So we had to work with it in different rooms on teleconferences. And so it was unlike anything I've ever done. But there were 5 big pillars to the bill. The first pillar was aid to individuals. So the per person, per family check that will be coming out this month, that was significant, along with enhanced unemployment insurance, eviction and foreclosure protection, and some other aid to individuals. Second was aid to small businesses, a sizable small business loan program, more than $300 billion, and then a few other smaller programs for small businesses. But the heart of the program is forgivable loans. If you get the loan through an SBA lender, many of you work with those lenders already, and you keep your payroll intact, the loan will be forgiven and will be converted into a grant. So that's the second chunk, the aid to small businesses. And small is defined as less than 500, unless it's in the hospitality or restaurant industry, where if you have multiple sites totaling more than 500, but no individual site is at 500, all of those sites can be counted as small businesses. Beyond the small business piece, pillar 3 is aid to middle and large size businesses There's a Main Street loan program that Senator Warner worked a lot on, other loans and availability of help for larger businesses. This will be heavily administered through the Secretary of Treasury. And also there's opportunities for the Federal Reserve to make lending more widely available. That's Pillar 3. Pillar 4, aid to state and local governments, which is a significant issue because state and local governments are not only seeing unanticipated expenses, but they're seeing some significant declines in revenue. And then the 5th pillar is aid to hospitals, community health centers, free clinics, our healthcare providers, including providers in the Department of Defense and Veterans Administration. Now, when we were working on the bill, we had to work on it in pieces. Senator Warner was very involved in pillars 2 and 3, small business and large business, as a member of the Finance Committee. I was heavily involved in pillars 4 and 5, aid to state and local government, and the hospital and healthcare pieces as a former state and local official and as a member of the Health, Education, Labor, Pension Committee. So we had to put this bill together with small groups doing different pieces of it and then trying to assemble it. And let me now just tell you the 2 asks that I have of you, which are very important. And I'm sure some of the questions will get at this, but we can go beyond. Putting these 3 bills together, basically 3 bills in 3 weeks with speed, there's going to be some pieces of it that we didn't get right. I mean, I'm just going to acknowledge it right now. We missed a detail, or we adjusted something too far hot or too far cold and we need to even it up, or we just forgot something, or even made a drafting error. When you act quickly, even with the best of intentions, that's going to happen. And so some of that we will see as we try to implement the bill. So the first thing that the Lynchburg Chamber, and then I say the same thing to Barry from the State Chamber, is if you see implementation issues, why haven't I gotten an answer from the SBA? I was supposed to get eviction and foreclosure relief. It's really hard to get answers about it. If you see implementation issues, reach out to our office, because some we can fix, or we can fix together with the administration, probably without new legislation, and we want to make sure we implement it as well as we can. And then the second ask that I would have for you, Megan, to you and the LRBA membership, is we will do at least one more bill. It may not be as big as the $2.2 trillion backstop package that we just did, but we will certainly do one more bill, particularly as this goes on for some time. One of the elements of the bill will be fixing anything that we didn't get quite right that needs a legislative fix, not just an administrative fix. And so we're already gathering, oh, this needs to be fixed legislatively with respect to, for example, how come the bill allowed hospitals to use their dollars to backstop revenue losses, but state and local governments were restricted to unanticipated expenses, not backstopping revenue losses. So we're putting together the list of things that we want to address in Bill 4, and anything that the LRBA or the State Chamber sees that you really need to address this, Gwen Mason in the Roanoke office, Paul LaPointe in the Richmond office, we would very much like to have that, because we're already starting to collect those ideas. Last thing I'll see is this. Look, this is an unprecedented time. I'm 62 years old. I've dealt with emergency management as a mayor and governor, from hurricanes to H1N1 to mass shootings. I've never seen anything of the magnitude of this. And it's very painful, and it affects every family. Everybody's worried about their health and the health of people they love. Everybody's worried at some part of their family about financial consequences. And it's hard not to know, when you don't know when the end date is, the uncertainty and anxiety gets accelerated because of not knowing all the answers. But we're a resilient people. The United States, frankly, we were slow out of the blocks in dealing with the nature of this crisis, and that's regrettable. However, what the U.S. has shown again and again is sometimes we are slow out of the starting gate, but when we turn our attention to a challenge, we have a momentum unlike anybody else, and we can lick this. Last thing I'll say is I just want to thank all of you, but I especially want to thank anybody on this call who's connected to the healthcare industry, because everybody who are our frontliners are really worried about their own health and their own finances, but they're also worried about their own exposure. They're worried about their children who are home with schools closed. So a special thanks to all of our frontline health professionals. And with that, Megan, I'll turn it back to you, and I'll look forward to taking up questions when the other presenters have offered their comments.
Thank you so very much. And thank you for our to-do list. We'll certainly get our input to you on the pieces of legislation and implementation. Next is Barry DuVal. Barry is the President and CEO of the Virginia State Chamber. Barry, great to see you today. Thanks for joining us. Okay.
It is great to be here. Thank you so much. And I want to begin by thanking Megan and Christine and the leadership at this great organization. The Alliance in Lynchburg is playing a very important role for the region. We grow and prosper along regional economic boundaries, and your region is an important and viable one to all the Commonwealth. So thank you for your leadership. Thanks to your board members and your investors. I also want to thank Senator Kaine for his leadership, and for Paul and his whole team. They have been extremely helpful for us as we have been communicating directly on the bill that was most recently passed, and a number of features of that bill that are helping Virginia business communities because of Senator Kaine and his leadership. So Senator, thank you for that. I just want to do a couple of things and save time for your individual question that might come. First, to say the business community of Virginia is taking this very seriously. I'm impressed with the leadership of the business community. It's really been acting as a partner with local government, state government, and our federal officials. Many of the businesses are creating innovative ways to stay in the stream of commerce. They're acting in a way that is very responsible by putting the safety of their employees first and recognizing that their employees and their families are the #1 priority for the businesses of the Commonwealth. And I'm very impressed with the leadership I'm seeing. Second, I've seen more innovative ways to continue business than I've ever seen before. Yeah. The stream of commerce is continuing in Virginia. It's not at the pace that we're used to, and it's certainly in a different format than we're used to. But I do want to say that those that are listed as essential businesses that are continuing, many of them are important to the national defense of the United States of America. And those contractors are continuing to find ways to provide for the service and provide for the technology and provide and keep manufacturing going. And Virginia contributes greatly to our nation's safety and our nation's prosperity. So I want to thank all the business leaders in Virginia and every region. I also want to say that the innovative ways of providing for flexible leave and working with individuals that have burdens is also important. Without question, there are industries within the Commonwealth that have been more impacted than others. In particular, our restaurant industry, the hospitality industry, those industries we may not think of that are also connected to disposable income and gathering is the entertainment industry. We have a significant part of the Commonwealth that are connected to those industries alone. Most recent statistics, Senator, I saw was that over 30 million Americans are just in those 3 industries alone. And Virginia is representative of that. And we're going to continue to have an impact in Virginia as across the nation, certainly in the short term in those industries. But again, I want to reference the leadership from Washington, bipartisan vote that occurred in supporting help for those industries and those people. I think perhaps in 2008, there was a concern that businesses themselves were being helped, banks were being helped, and Wall Street was being helped, but Main Street wasn't being helped. I think in this particular time, people in Washington have been very focused on Main Street and very focused on their individual employees. So I want to commend them for that. In terms of the chamber itself, we, like you, have been working and created a resource center. They can go to our chamber website and find national programs, get the details of the CARES Act, as well as focus on and get the benefits and how to apply for individual loans and individual business loans. I believe those will begin, applications will be open on Friday, April 3rd. And I know it's a priority of the Treasury and a priority of those in Congress to get those loans out. I heard them referred to as groans the other day, and I said, what is a groan? And they said, well, it's actually a loan, but it's going to be a grant, so you really don't have to pay it back. So I'm hopeful that is true as we get through the process. But in my hopes that these particular federal programs will allow businesses to bridge the gap from the time that this has actually begun. And some of your listeners may not realize it begins, you can apply mid-February and go all the way through the end of the summer. So I want to mention that to you as well. A couple of things that I will say from a state chamber perspective. We have been working closely with the governor on a number of initiatives, not so much in the health area. I'm looking forward to Dr. Gately's discussion on that, but on public policy and how it impacts business. We just came through, it seems like a long time ago, but we just came through a very different General Assembly than Virginia has ever come through before. And it was an assembly where I believe the new majority was demonstrating that they had a number of ideas and they wanted to put those ideas forward. The leadership that I spoke with in the General Assembly, I asked them if they would think about the public policy in this fashion. At the end of the General Assembly, we want to continue to be the best state for business. And at the end of the General Assembly, I know they want to demonstrate a business-friendly public policy. But there's also a desire on their part to demonstrate some progressive policies. And those progressive policies do not necessarily have to be in direct competition to our goal of being business-friendly. So we work closely with members in the House and the Senate and leadership on both sides of the aisle. And we weren't 100% satisfied with the way that all those bills ended up, but many of them are law at this time. The governor has signed them or will sign them shortly. But we sent a letter to the governor asking him if he could delay some of the implementation of some of those particular bills. For example, minimum wage would increase January 1 of 2020. We've asked the governor to consider delaying the implementation of the increase of minimum wage. There are some other project labor agreements and prevailing wage that would go into effect. We've asked the governor if he would consider deferring the implementation of some of those bills. Our reason is not to debate the merits of those bills. They've been debated and they're law. Our reason is to help Virginia businesses have the best chance at bouncing back as possible when they come back. And many of those small businesses need to bounce back quickly, and increasing in cost and increase in employment costs would perhaps prevent them from bouncing back as quickly as they could. So we hope the governor is willing. I think he has indicated that he wants Virginia to remain the best state for business. And I have his assurance he's going to look at that over the next several weeks. Beyond that, I just want to close by saying that we don't know how long this is going to last, but I believe that Virginia will emerge with new business practices, with more creative and innovative ways to put people to work. And I think that some of the leadership we've seen from our state leaders and certainly the leaders from Washington have demonstrated a partnership and a cooperative relationship between business and industry and government that we perhaps haven't seen as effectively as we're seeing now. But thank you, Megan, and thank others who are on the call that I can't see. I look forward to your questions, and thank you for your leadership in the Lynchburg regional area.
Thank you so much. Thank you, Barry. I appreciate that. And I remind everybody who's watching that to please use the icon at the bottom of your screen that's called the Q&A for your questions, and you can go ahead and start sending those in now. Dr. Gately, the floor is yours. Welcome, and thank you for being with us today.
Thank you, Megan. It's good to be here. I'm Dr. Kerry Gateley, as mentioned earlier. I am the health officer and health director for the Central Virginia Health District. Megan, thank goodness I don't have all of VDH.
Yeah.
I am a health director for the Central Virginia Health District, which is our area, and also the West Piedmont Health District, which includes Henry Martinsville, Franklin County, and Patrick County. When I was in medical school in Tennessee, the older students, the more advanced students, described the experience to me as I was coming in as trying to drink from a fire hose. And that was pretty apt then, and it's really apt now. I mean, the information that's coming out, it's all that I can do to keep up with it. One of my jobs is to try to review everything that's coming out of CDC, out of the World Health Organization, to review studies that are coming out in medical journals, all these different sources of information that I have available to me on what's going on with SARS-CoV-2. That's the virus that causes COVID-19. I also try to keep up with what's going on clinically as we increase our understanding of COVID-19 illness itself and the kinds of problems that we have with that condition. One of the most important pieces of information that's really just now becoming clear is that people without symptoms of COVID-19 or people with minimal symptoms of this illness can actually transmit the virus, can actually cause infections. That wasn't totally clear as we were getting started with the outbreak, the pandemic that we have now. But it emphasizes again the message that we've been putting out for some time, the importance of, for example, our social distancing recommendations, hand washing, and so on and so forth. This virus is pretty easily transmitted, it appears. And that's why what seems like perhaps extreme measures are sometimes recommended and sometimes required. So I'm trying to keep up with all this information and trying to make it available to the people in my district. I have spent a lot of time in the past several weeks serving as consultant to area businesses, profit, nonprofit alike. Of course, I've been in constant consultation with Central Health, our hospital system, exchanging information there. Other government agencies, I've been working with our departments of social services, for example, in this area, our emergency responders, and really so many more. I'm trying to find this information and process information and make it available. This is also, as best I'm able, available to all of our businesses. And I'm still available for calls, consultations, and emails on that. When we're not doing that, I have a very dedicated staff in my health district and my health departments. When I looked right before this call, we had just shy of 1,500 cases that have been reported statewide. This morning, when I got to work, we had 20 cases reported in Central Virginia Health District, this district. It's getting to where that number is changing every few hours. And that presents quite a challenge to us because every time we get a report of a case, and this is of course a laboratory confirmed case, we start an investigation process. And that starts with a case investigation where one of our nurses, one of our staff is contacting the case and trying to get as much information regarding that individual, what their situation is, and particularly who they may have come in contact with. So we're trying to create a contact list, for example, and then each one of those needs to be called. Each one of those contacts needs to be contacted to see if they need to be in quarantine, to see if they need to be in a self-quarantine. We've had one case that gave us, for example, 36 contacts that we had to follow up on. That's a lot of calls. And that's a lot of follow-up. We're doing it. We're keeping up with it right now. But as these case numbers increase, then that's really going to be a challenge for us to continue that activity. And of course, we're not alone in that. We know the challenges that we're already expecting our hospital system, for example, to face, as well as our emergency responders. So really don't have time for much more than trying to keep the community educated and trying to keep up with our epidemiology, our public health duty to find these cases and educate them and find the contacts and try to stop or slow down at least the spread of the virus as much as we can. There are always a lot of questions, a lot of which I don't necessarily anticipate well. So, if it's all right, but there's so much territory to cover, I would rather just try to respond to questions than to explain what's going on.
Okay, well, I appreciate that. Thank you so very much. I'm getting questions coming at me from the webinar as well as my own text messages. So I'm going to be looking at a couple different areas. Barry, you touched on this in your presentation, but I'm going to ask the question again. And really, I'm going to ask the question of all of you. What do you think? How do you see business changing moving forward after going through a pandemic? How do you see the state of Virginia business changing? How do you see businesses changing in general? And Dr. Gately, how do you see some of our health practices changing? I've seen these comments about, we're doing a lot of communication about don't touch your face and how to wash your hands. Will we go back to washing our hands as much, and those sorts of things? So how do you see business changing? And Barry, you alluded to innovations. And so, what sort of innovations can you tell us that you're starting to see?
Yeah, I think I will reference something that Senator Kaine said many years ago. I think he was Governor Kaine when he said, "Don't let a crisis go to waste." We were talking about, Senator, the fact that you were one of the only governors in the history of Virginia that left office with a budget smaller than when you came into office. During that time, we were going through a very challenging time as a result of the financial crisis. Now, this is not a financial crisis at this time. It's not what brought this on. But businesses and government had to learn from that 08-09 crisis and begin to implement changes. And I think some of those changes have been very good. For example, in the banking industry, we're much more solid today because of some of the steps that Washington has taken. Perhaps the pendulum has swung too far on some of the smaller businesses. I think they've come back and gotten that correct. But I think Washington has learned and businesses have learned from the financial crisis. I think this COVID crisis is also teaching businesses how to be creative and innovative. And I will just give you a couple of examples. Many of our industries in Virginia, especially tied to the federal government, are service-oriented businesses. And those in Northern Virginia, you often think about, but it's really throughout the Commonwealth. And those service-oriented businesses are continuing to operate today through platforms, many of which have been in place, but not utilized as much as the platforms are being utilized today. So Megan, one of the findings of the last 3 weeks has been the ability to remain productive as a result of innovative virtual platforms. And I think that will continue. Second, I think businesses have learned to be creative with flex time and be more responsive to the needs of their employees. And they've been able to do it without seeing a fall off in productivity for those that are service-oriented businesses that can use computers and technology. So I think that's going to continue as well. And one of the challenges maybe for us is that we thought work was a place that we went to. Now we find work is something we do all the time. It is not confined to a physical location. That has really become more evident as we have gone to remote work areas. The third thing, though, the fourth thing I would say lastly is we are really people, though, built for community. And while we can be productive working at a distance, we can't be as complete as individuals working at a distance. And we have to be connected to other people. And so more Zoom and more FaceTime and more streaming is what I expect to be done. Obviously, long-term, that's going to impact the travel and leisure industry, and they'll find ways to adapt to that as well. But if anything, the last 2.5 to 3 weeks has taught us is while we can be productive in technology platforms, we can't be complete until we figure out how to remain connected to each other. So these platforms where we can see each other and express ourselves both verbally and visually are going to remain, and I think even grow more so for productivity and the way we get business done. So that's just a few observations I have, but I think those lessons learned will continue into the future. And I would be interested, Dr. Gately, if I could ask him a question, how long does social distancing remain in effect after we come back from this? I'm taking a little bit of liberty as your panelist here, but one of the questions I have and I think about for business, many of businesses have people working close together. And when we come back into the workforce, will we find those further apart than perhaps they used to? And and what impact will it have on the workforce, and what impact will it have on other aspects. I think about movie theaters and conferences and conventions, and will we be learning our lesson, or are you going to say once we create an antidote for this virus, humans are going to go back to way they were before? I don't want to preempt the question you have for him, Megan, but I'm interested in how that's going to impact business.
I think, well, first of all, I think Megan mentioned the fact of will we go back to washing our hands less, and my response to that is I certainly hope not. If this pandemic is teaching us anything, it's the importance of hygiene. It's the importance of personal protective hygiene. You know, every year when flu season rolls around, for example, I'm putting out my message about how the flu is transmitted and how important hand washing is in a flu outbreak. And I don't know, I guess we've said it so much that people get tired of hearing it and they don't think about it too much. I think we'll get more attention from this point forward when we talk about how to avoid transmitting viruses and diseases of all kinds. As far as the social distancing, that'll be a lesson learned. I don't foresee us maintaining anything like that indefinitely. I don't think for human beings as social creatures, that's going to be possible. But hopefully as we relax on the idea of social distancing, we won't relax on the idea of clean hand and covering your cough and covering your sneeze and so on and so forth, because those are just going to be good practices no matter when. The previous question, one of the interesting things from a business standpoint for me is what's going to develop in telemedicine out of this. The governor has asked us, and the commissioner of health has asked us in the health department, for example, to do a lot more teleworking. I'm talking to you all from my home, for example, in compliance with that. We're starting to find out a lot of things we can do remotely by telework or by these modalities that we have here that we've never really thought about doing before. And I think when we get out of this pandemic, I think a lot of those lessons we will take with us. Like I really can do a number of things remotely. I really don't have to cram everybody together in the office. The human contact is good, but we realize that maybe even more effectively or maybe even more efficiently we can get our jobs done using these modalities. When I realized I was going to be on this particular meeting, I really didn't know much about Zoom, to tell you the truth. And so over the weekend, my daughters trained me on, we had a practice meeting with them training me how to do this. Now that I'm doing this, I'm seeing some advantages to it that I wasn't aware of before. So I think in terms of what people are learning about telework and our ability, for example, maybe to do things by telemedicine that we did not think we were able to do before, I think we'll carry those lessons forward.
Great. Thank you, Dr. Gateley. Senator Kaine, what are your thoughts on the question on how the state of business is going to change and the innovations we're seeing moving forward? What are your thoughts and your perspective on that? Megan,
we could do a whole seminar on that, but let me just mention 2 points. So to build off what both Barry and Kerry were saying, the work that we've done over the last weeks does show the ability to telework. It raises future possibilities for telemedicine. Our colleges and even many of our K-12 schools are now delivering content online. That's great, but it's only great if everybody has access to high-speed broadband. So there's going to be a dramatic need at the national level to really roll out higher quality, high-speed broadband to everybody, because these will only work in communities that have that access. So there will be more burden on our shoulders to create equity there. And then a second issue that's big, and this could be a big economic opportunity. Barry and I chatted about this. I'm on the Armed Services Committee. We don't manufacture weapons systems in other nations, adversary nations, because it's about national security. But over the years, we've allowed much of our medical supply chain to be outsourced. Pharmaceuticals, masks, other PPE, we've allowed that to be outsourced. Now, maybe we have to think about some portion of the medical supply chain as a national security imperative and bring it back on shore. Part of the third bill that we passed the other day was something I worked on with Senator Rubio to begin that exploration process, because we may want to have more control over our own destiny on these important critical assets. So those are two areas where we could see some significant long-term change to the way we do business, educate each other, get health care, provide for medical equipment, and other medical supplies that could come out of this.
Thank you very much. Okay, I'm going to start. Senator Kaine, this next question is for you. If the coronavirus is still active and Americans must practice social distancing, how does America conduct elections in these conditions?
A very, very important question. You'll have a lot of folks. I mean, look, there's local elections in May in Virginia. There's state primaries in June in Virginia. And then there's obviously the federal election all over the country in November. And if people are worried about, well, gosh, I'm not supposed to go out, or I don't want to wait in line with a big crowd, will that reduce turnout? In the bill that we just passed, we included $400 million for states that will just be granted out to states to help them grapple with how they can provide more opportunities for people to be engaged and involved in ways where they'll feel comfortable and they won't risk. I think we really should move to more online voting. Vote by mail. At least 3 states, Colorado, Washington, and Oregon, do massive vote by mail, and their voter participation rates are among the highest in the country. Now, our Virginia General Assembly just changed a number of the rules about voting in Virginia. As you all know, if you want to vote absentee in Virginia now, you have to meet one of a number of kind of criteria. I'm ill, I'll be out of the state that day. Beginning on July 1st, you'll be able to vote in Virginia. If you want an absentee ballot, you don't have to have a reason. You can just say, send me the ballot early. And I suspect both parties going into November will really try to maximize the chance that folks vote by mail. That will speak to some people's concerns about infection risk. But I see a dramatic increase in that going on in Virginia and probably all over the country.
Okay, thank you. 1 second. Small rural colleges like Sweetbriar in Amherst County are seeing massive financial losses. What is the state and federal government talking about? Are they starting to look at ways to financially support small rural colleges like Sweetbriar?
The provision in the sort of fourth pillar that I mentioned, aid to state and local governments, that also included educational and higher ed and educational institutions. So there was about $250 million. That's going to be Virginia's share of about a $14 billion national resource bank that will go to Virginia for use in dealing with Virginia's colleges, both public and private. Those dollars are available public and private. And then there's another about $70 million that is given to the governors in Virginia to deal with education expenses broadly. So it's basically $250 million for higher ed, $250 million for K-12, and then another $70 million that will be up to the governor to decide how to allocate. So the right thing for colleges to do is to reach out to the governor. In addition, look, a college with fewer than 500 employees is a small business. It's a 501c3. One mistake that we need to fix, and Barry and others pointed it out, is many chambers of commerce are organized as 501c6 organizations. They were not included in the definition of small business. We probably need to fix that. But anybody in the 501c3 space, you can also seek assistance in the small business loan pool, and many of the private colleges are organized that way.
Okay. Barry, do you have anything to add? I see you shaking your head.
I was just going to build on what the senator said as it relates to the 501c3. A lot of the educational institutions will qualify under that provision, and the senator and I were speaking about that in advance of the bill passing. I'm glad they did not overlook that, because a lot of organizations in the Commonwealth do great amount of good, but they happen to be organized as C3. That was a provision included. Many others are C6, and they are hopefully going to, if necessary, have another round. And that's just a question, without losing the senator here, and as we go to a close in a few minutes. I know the Treasury Secretary wants to see the impact of this particular round of stimulus, and I think we will know a lot more 30 days from now than we know today. But Megan, I'm sure a number of people are curious and of the Senator's view on whether there could possibly be a fourth round.
Right.
Barry, I am confident there will be a fourth round, and the question is sort of how soon, because I think we do want to see where are the implementation glitches and discover, well, what are some of the things that we probably should have included. And we're already making a list, and I think we already know some glitches that can be fixed, but we may not discover some of them until we're a week or two down the road. So we are in a recess partly because of the social distancing requirement until April 20, but during this period, we're all on the phone talking to stakeholders to gather ideas for that fourth bill. And I am confident you'll see a fourth bill, but it'll probably take us a while to just make sure we're gathering the full to-do list for that fourth bill.
And that's what I expected. So I think part of the message for your listeners would be to see what the impact is on this, Megan. We are certainly keeping a list, Senator, and we would be happy to advise based on some of the input we're already getting from our members. If there's any concern at all on our members' part, is simply speed to market. And I know that Congress intends for it to get in the stream of commerce very quickly, and I know the administration does. So implementation, speed to market is important.
A lot of the questions we're getting dealing with how soon, what's the expected turnaround once a grant or application is made? What are they projecting the turnaround time from date of application to receiving funds? And then also questions about are sole proprietors included in the CARES Act?
Yes, sole proprietors are included in a couple of different ways. So on the first piece, time, we're hearing the estimate from SBA and others of 2 to 3 weeks. That's the estimate we're hearing, but it is going to be really helpful to us to hear from our Virginia businesses. Well, I applied and it's been 2 weeks and I've got the grant, or it's been 3 weeks and I don't. So this is one where feedback from Virginia businesses is going to be very important. Sole proprietors are included in a number of ways. So in the unemployment insurance space, Mark Warner always points this out. Only about 30% of traditional workers are covered by the unemployment insurance programs because, multiple part-timers, self-employed, independent contractors, gig workers, a lot of them are not. So this unemployment insurance expanded benefit, we call it unemployment insurance on steroids because it's an enhanced benefit for 4 months, but it also covers a much wider range of people, including sole proprietors. And I would think that sole proprietors would be equally able to access the small business loan portion. If you are interested in the small business loan, what you just do is you just go to your lender or any lender who's SBA approved. Most lenders are, some who aren't are working to get approved quickly, and the SBA approved lenders will help work you through the application process.
Question, there are a number of faith-based groups, congregations who are also employers to citizens of Virginia are also impacted like businesses are. Is there a way for them to get any support to prevent closure of these particular faith-based businesses?
My sense is many of the faith-based businesses are organized as 501c3s or for charitable religious or eleemosynary reasons. And if you're in the 501c3 space, you can qualify for the small business loan portion. And that was an example of something. The original proposal for small businesses did not include 501c3s, but Barry and others pointed out, how much social service work, or if you think about all the arts work that you guys have in Lynchburg downtown, arts, cultural institutions that employ a lot of people and that really are part of the fabric of a community. And many of them are very small. So it was really important to get reminded by folks out in the field about that and then make sure the 501c3s were included. And that would include many, if not all, I think many religious institutions would fit in under that banner.
Yeah. Thank you so much. I really want to thank you, Senator Kaine, Barry, and Dr. Gateley for joining us today for our Wednesday at 1 webinar. Questions that did not get answered are regarding the SBA loans. I'd like everybody watching and listening to go to the lynchburgregion.org website. We have the information for the Small Business Development Center on that website. That the information about the emergency disaster loans, as well as the granting process. And we also have a comprehensive list of the banks in this region that are SBA preferred lenders. So all of that information can be found at the lynchburgregion.org website. We really do appreciate everybody's support today. I want to give, I've got a couple thanks and some more information. Thanks, Senator Kaine, to your staff. Gwen, as always, Gwen Mason is really fantastic to work with. All of the Alliance teams and really all of our elected officials, state, local, federal level. Thank everybody for their leadership. You know, leadership is not always easy and it's challenging times. And we out here in the world, your citizens appreciate the time and commitment that you've given to all of us. I also want to give a shout out to Preston Bryant. I think Senator Preston Bryant was, I believe, your Secretary of Natural Resources.
Indeed, he was. Yeah.
He was really helpful and working with Gwen and your team
Right.
to help you coordinate for this. So we really appreciate Preston. Coming up in the future for future webinars, I don't know if everybody's been paying attention to Zoom bombing. As all of us are starting to do more and more with Zoom. There's folks who are trying to take over our Zoom meetings and maybe doing some not so nice things with the images. So as a result, for future Zoom meetings, webinars that we're doing, we will be asking the public to RSVP and register. Once you register for that, you'll be sent the information. In other words, no longer is it safe for us to just publicly post where to come to the Zoom meeting at or the webinar. So all of our future webinars, you'll need to register for those at lynchburg.org. Once you register, we'll send you the critical link that you need for that. Just so you know, up and coming, this Friday will be our, we have the first Friday of the month, we do AM Alliance, where we get together, Dr. Gateley, and we shake a lot of hands and we pass a lot of business cards. And we're not doing that Friday, but we are doing it digitally. So please, everybody, register for that. Also, we have a virtual masterclass coming up, and that's really targeted towards our nonprofits, and that's called Navigating Uncharted Waters During a Period of Hyper Change. That'll be April 7th. The speaker is Michael Gelman, who is the founding and principal shareholder for Fiscal Strategies for Nonprofits. The next Wednesday at 1 webinar will be tips for working parents with COVID. Like a lot of you have teammates who are working at home and also educating at home. And so how do you manage work and children bumping around into you while you're executing? And then following that, we'll have Leadership Lynchburg will present lessons with leaders during COVID, and that'll be April 9th. And I'm sorry, the tips for working parents will be the webinar on the 19th, will be the webinar, I believe, on the 8th. I appreciate all of you very much.
Hey, Megan.
Yes, sir.
If I could say one more thing, and then Barry may want to do this too. If you didn't get your question answered on my website, which is kaine.senate.gov, there is like frequently asked questions about the bill that we just passed, the loan provisions, etc. That will likely answer your question, but if you don't see the answer in the FAQs, you can send in a question and we'll get an answer to you. And obviously Senator Warner, and in the Lynchburg area, both Congressman Klein, Congressman Riggleman represent the area. We probably all are really focusing on that in the next 3 weeks, answering constituent questions. So go ahead and get on the website. You can get questions answered that way. And if your question isn't answered, just send in an email. We'll get you an answer.
Absolutely.
And the same with us, Megan. I know you want to run. I want to say they can go to bduval@vachamber.com or policy@vachamber.com. We'll answer whatever questions or resources they have about state legislation and business. And let me just thank you and your leadership team for this. Working together, we'll get through this and we'll be stronger for it as Virginians. Thank you.
Thank you so much. Everyone, I hope you have a great day. Final and closing, the Small Business Development Center is located with the Lynchburg Regional Business Alliance. You can reach out to our office to get connected. And again, we can answer your questions as well. Everyone, stay safe, have a great day. And remember, we are resilient. We will survive this. Thank you so much.
Thank you, Megan.
Thank you. Take care, y'all.